Welcome to Social Work Week 2024 and to this event, System Regulation versus Individual Professional Regulation. What does this mean for me? It is a cross-regulatory panel, if you want, or session, and we are really pleased that you are able to join us this morning. I am Iona Roberts. I am one of the regional engagement leads for Social Work England, and I cover East of region. We have today with us three main presenters, and these are Jeanette Blackburn, Regulatory Policy Manager from Care Quality Commission for Adult Social Care. We also have Lella Andrews, Local Authority Assessment Manager from CQC, for Care Quality Commission, and Louise Broddle, Head of Fitness to Practice Investigations from Social Work England. However, before I will hand over to the three main speakers this morning, I will go very quickly through some housekeeping matters. Probably you're quite familiar by now with all of those housekeeping information we'll provide. Nevertheless, we do have a legal disclaimer, which is currently hopefully visible on your screen. Any views, information, or opinions expressed by third parties during Social Work Week are the speaker's own and do not necessarily reflect the views of Social Work England and its employees. Social Work England has not endorsed third-party content and accepts no liability for the content of third-party or sector-led sessions throughout the Social Work Week. Your privacy is really important to us. By providing personal information, and we all know that you have provided your name and email addresses, such as your name, you agree for us to contact you for the purposes of event management and feedback and evaluation. My colleague Kate, who is also present this meeting, somewhere in the background, like myself, we're going to mostly support this session from the technical point of view. She's going to post later on towards the end of the session in the chat a feedback, an evaluation form, and we are looking forward to hear your feedback and any kind of ideas you might have how we can improve any future events. Your personal data will be retained up to 3 years in accordance with our data retention schedule, and you can find more information about our data retention schedule on our website at Social Work England. And finally, I'm now going to hand over to Jeanette, and Jeanette, I'm going to ask you if you can unmute your microphone and bring Lella on the screen as well. Yes.
Good morning.
Right. And Louise. Okay, that's it. Right, back to you now. Jeanette, do you want to come in?
Okay. Thank you, Iona. Yes, hi everybody. I'm Jeanette Blackburn. I work at CQC as an Adult Social Care Policy Manager, and I'm with my colleague Lella today to talk to you about CQC's new role in local authority assessments and what that means for yourselves as social workers or other allied roles. So just to set the scene, we have a new role at CQC to assess how well local authorities are meeting their social care duties under Part 1 of the Care Act. It's a very clear scope, and that's will be the complete kind of scope of the assessments. It won't go into other things. So we've spent the last couple of years designing an approach in co-production with the Department of Health and other key stakeholders such as the LGA and ADAS, Social Work England, the Chief Social Worker, and lots of different stakeholders have been involved in that. And we've also undertaken some testing of the approach and some piloting. We evaluated the pilots, and this confirmed that the scope of the assessment framework, which I'll tell you a little bit more about in the next slides, the scope of the framework enables us to generate the evidence that we need to make our judgments and to do the assessment. The approach has been approved by ministers, and we've produced some guidance which is on our website to set out the high-level framework that we will use to assess local authorities, and indeed we are using that now. So together with these assessments and our other new power to assess integrated care systems, and of course our continued work to assess individual providers, this gives us a unique view about health and care across systems, and enables us to look at and to comment on and be an authoritative voice on what is happening across systems, rather than just looking at individual providers as they operate. Thank you. So in terms of the local authority assessment particularly, this will help us to illustrate the quality of care in a local area and provide independent assurance on how well that is being provided. And to think about the context, of course, in which local authorities are operating. We will be able to develop an evidence base on how local authorities are delivering their Care Act duties. And of course, we can report on what we find locally, but also to aggregate that up into a national picture, which should enable us to highlight challenges at local and national level and some of the risks and the impact that the work is having on local populations. We will support improvement through showcasing best practice and new and innovative ways that local authorities are finding to provide care and support to local people. And through all of that, we can use our evidence and our independent voice to inform and influence wider system reports. And we're really excited at CQC to have this role. It's something that we've wanted for a long time. And as I've already said, this gives us a real good opportunity to start looking at how systems work to really drive improvement. Next slide, please. Thank you. We will be using our single assessment framework to do our work. And some of you may already be familiar with this. So this is our new approach to assessing all of the things that CQC now has responsibility for. So assessing ICSs, providers of all types, and local authorities. So we have a single assessment framework that consists of 34 different quality statements, and they're structured into 5 key question areas: safe, effective, caring, responsive, and well-led. From those 34, we have selected 9, which we will use to do our local authority assessments. So we're only using 9 simply because the scope of the assessments is limited to Care Act duties. So we don't need to use the full 34 quality statements areas. Those quality statements set out the commitment of the local authority in terms of the standard that they will aspire to in relation to the particular topic areas that we're assessing. And they are aligned with I statements. And these are statements that describe what an individual person should expect to experience if the local authority is delivering to that good standard. And those statements have been developed with people who use services. We have a number of evidence categories that we set out explicitly, that where we will gather evidence for each of those quality statements, and very specific evidence items and quality indicators that we will gather to make our assessment. These are all explained on our web pages, and so you know exactly what it is that we will be looking for and looking at when we do our assessments. And all of that is underpinned by best practice standards and guidance that you will be familiar with in your work. And again, within our assessment framework, we've set that out to show exactly what does good look like, what national best practice and guidance will we be drawing on in our assessments. Next slide, please. So in brief, the 4 key areas that we will be assessing are listed here. There's 4 key themes when we come to a local authority, and the bullet point items underneath each theme are the quality statements that we've taken from our single assessment framework to use to make our local authority assessments. So we'll be looking at how the local authority works with people, assessing needs, support to live healthier lives, which is all about prevention, early intervention, reducing future needs. We'll be looking at equity and experience and outcomes. Then looking wider about how the local authority provides support through its care provision, commissioning, market shaping activities, and working with partnerships and communities. We will look at safety, so that's safety across systems, pathways and transitions, and of course critical duties around safeguarding. And underpinning all of that, we'll look at aspects of leadership around governance and management and the organisation's approach to learning, improvement and innovation. So it's very comprehensive, but as I've said before, the scope is limited to Care Act responsibilities. Thank you. So I'm going to hand over to Lella at this point. Thank you, Lella.
Okay, thanks, Jeanette. Hi, I'm Lella Andrews. I'm one of the assessment managers in the local authority assessment team. I've worked for the regulator for a fair while, and I've been part of the development of this work for the last nearly 2 years. So that's just, this slide just gives you a bit of an indication about the people that make up a team in terms of assessing a local authority. So the CQC team is led by a deputy director. We have assessment managers and inspectors, and we have planning coordinators. But whilst we're on site and also in an advisory capacity to each of the assessments, we have executive reviewers who are mostly people who are working at the level of a director of adult social services, and they have applied to be executive reviewers with CQC, and one of those will support on each of the assessments. We also have specialist advisors, and some of you may have applied and been successful at becoming a specialist advisor. Often those people are working at team manager and principal social work levels. So they are there to give us some additional advice and guidance on specific issues. Next slide, please. So what can a local authority expect? So we have principles for scheduling our assessments, but fundamentally we have to complete all 153 local authorities within a 2-year period. We started off 2 years ago only having 151 local authorities, but two of you decided to split, so we're up to 153. So we'd appreciate it. No more splitting of local authorities, please.
Yes.
Otherwise we're going to struggle. So the first a local authority will know about an assessment is when we write to them, to the DAS, and inform them that we are starting their assessment, and we ask for them to complete a number of items of information, but the main one of those is the information return, which asks for information about a range of issues that we're looking at, which all link to the quality statements and the evidence that Jeanette was talking about. So we don't tell the local authorities at that time the date of the site visit, but what we do is tell them that we will give them 6 to 8 weeks notice of the site visit. So we batch our work, so we send out information returns to several local authorities at once. We then start work on that information. We review and analyse the information we've been sent. We also start talking to some of the organisations that are working within the volunteering community and faith communities within that area. We also start some of our case tracking work and carry out interviews with carers. So when we do come on site, what we're mostly doing is corroborating the evidence that we've already got. So all of that review of the evidence that we've had prior to us coming on site helps us to plan who we need to speak to when we're on site and what questions we're going to ask. And after that, we take all of those bits of the jigsaw puzzle and we analyse everything that we have in order to give a rating and to write a report on our findings. And that report will go through an internal quality assurance process, and also currently, because we've only recently started to assess local authorities, we are having a calibration panel which includes some very senior people and external people on that panel, just to ensure that our judgments are consistent and proportionate. Next slide, please. So we talked to a whole range of people. So we talked to, as I said, prior to coming on site, we talked to a range of voluntary and community groups in the area that the local authority work with. They may be ones that they commission directly with. They may be voluntary and community groups who are working in that area that are not commissioned. We always will talk to Health Watch. We talk to our colleagues in our operational teams to hear what their views are in terms of the local authority, and that will be mostly in relation to how safeguarding is managed and how they work with your quality monitoring teams who are assessing and monitoring care homes and domiciliary care providers. We talk to the senior leadership team of a local authority, and we arrange that meeting. We put aside 3 hours for that meeting, and we arrange it prior to the site visit. It gives the senior leaders an opportunity to talk to us about the opportunities and challenges in the area, to introduce us to their structure, their senior leadership structure, and who is responsible for which teams and how your frontline teams are set up. Because actually, when we come on do the site visit, we want to focus, other than set senior people who we will always talk to that I'll come on to, we want to focus on talking to people like yourselves who are the frontline staff teams. And when we do that, what we want to do is understand how you work. So, you know, we don't come and tick off your answers. We come and try and do that in a way that's a conversation, because actually every local authority has either the same name for job titles, but you do different jobs, or you do the same jobs and you have different titles. So what we need to do is to try and understand what your individual roles are, how you're working with people, what challenges you see, and really we also want to hear about what you're really proud of in terms of the outcomes for people and how the work that you do really improves outcomes for people. So we talk to unpaid carers. We have CQC works with an organisation who support experts by experience, and they are part of the team in terms of the assessment, and they talk to a number of unpaid carers so that we can get their views. We do case tracking, which means we identify a number of people that we would like to speak to individually and have a look at their records, but it's not a records audit. It's just about helping us understand somebody's journey. And however many people we choose with the case tracking is only going to be a drop in the ocean for the number of people that your local authorities are supporting. So we look very much as part of the information return. We're asking local authorities to tell us about how they engage with their communities, how they find out where the groups are who might be at risk of inequalities, and how they get feedback about the services that are being provided and how that develops future strategy. So we send a survey to all the regulated providers in your area in terms of adult social care. As I say, we have a real focus on talking to frontline staff teams, and as well as a number of interviews that we've set up, we also hold a couple of drop-ins. So these are much more informal kind of opportunities for people to come and talk to us. We ask the local authority to just provide us a room to notify all the staff that we're there, but we don't want that as a managed booking in system. We always will talk to executive leaders when we're on site. So we talk to the chief exec, we talk to the DAS, we speak to the portfolio holder in terms of the councillors and the shadow portfolio holder for adult social care. We always will talk to partner organisations. So we talk to the Safeguarding Board Chair. We'll talk to the local trusts as well, mental health trusts and acute trusts. We may talk to MPs. It depends on whether they have a specific concern or an issue they want to raise with us. And we also are very happy to talk to people using services through co-production. So the most tricky, myself and a colleague during the pilots went to an interview that was on Teams with a youth empowerment squad, which was their name, and they invited us to join them one evening via Teams. And we thought we were going to interview them, but actually they interviewed us and started off with, we had to describe ourselves as a chocolate bar and the reasons why. And that was probably the hardest question I've ever had, ever. So, but they're the kind of interviews that we want to do. We want to hear from people. And if we have a specific need, if an issue has come up through our conversations or our review of the evidence, that might direct us to talk to some additional people, maybe someone around housing and how that links with adult social care. Next slide, please. Okay, thank you. So following, as I say, it is like a jigsaw puzzle. So following all of that information gathering, the lead assessment manager puts it all together, analyses the evidence. We score at each individual of the 9 quality statements. So there is a rating given to each of the quality statements, which gives the overall rating for the local authority. And the report will be sent to the local authority for them to have the opportunity to provide us with any factual accuracy comments if required. So we may have said, you know, that there's 10 community teams, frontlines teams, and there may be 15. So those are the kind of things that we give the local authority the opportunity if there are those kind of things that we've inadvertently got wrong. As I've said, we then have a calibration panel, but that is unlikely to be for the whole 2 years. All reports are published on our CQC website, and at the moment we are publishing them in batches. So after the calibration panel, then currently we're just completing 3 of assessments, and they will all be published at the same time. Thank you. So I'm going to hand back over to Jeanette.
Brilliant. Thank you, Lella. Yeah, I just wanted to give some reflections and some insights that hopefully will be useful to yourselves about our assessments and how they relate to social work and the kind of role that you may well have within the assessments, and hopefully just demystify some things and maybe bust a few myths. So as I've already said, we're looking at the Care Act duties and the impact on people, and we're gathering all this evidence and evaluating it to make our judgments. But ultimately, we're wanting to understand how well people's needs are understood and met in the local authority. What is the quality and diversity and availability of local services? You know, how well is partnership working and integration leading to people's experiences and outcomes improving? Is there a culture of learning and improvement and innovation? And what kind of overarching governance arrangements are there? What opportunities do you have to contribute to the where the organisation works, and to ensure that you have a voice and that is heard and is integrated into the governance and the strategic approach and some of the priorities and areas where improvement is needed? We recognise that social workers, occupational therapies and other kind of support social work staff that aren't necessarily qualified but are working in that capacity, you are often the people's first point of contact with the local authority. And because of that, you've got a critical role in setting the standard for the quality of people's experiences and the outcomes of their social care, and the opportunity to really focusing on addressing inequalities and promoting human rights. So you've really got a critical role in leading and driving person-centred, strength-based practice. And you've really got a unique insight because you're really at the front line, that interface with people, really seeing things and having that ear to the ground. Because of that, we recognise that you've got a critical role in supporting the assessment of the local authority that you work in. So during the assessment, we would like to hear from you about your views and your experiences on these things. From your point of view and that of your teams and colleagues, how are local people experiencing care in your area? What are the patterns that you're seeing? How do you and the local authority approach risk management? How, you know, what things are going really well, what needs to improve, and how do you know that? And as I said, how are you able to contribute to shaping the council's approach? Are you able to work effectively with partners and agencies? Are you able to support unpaid carers, and do you get support for your own professional development? So it's very much about that conversation, as Lella has already explained. It's not us coming to you and checking your professional practice. We're not going through a checklist of how you do your assessments or develop care plans. It's that holistic picture. You know, we're not looking at your case files to do an audit to check have you filled in that document or, you know, use that particular format or report. And we're not making judgments solely on data. So we're not going to say there's a massive waiting list in that area and therefore that gets a poor rating. Yes, we do look at data, but that's taken in the round with the wider evidence set that we generate through conversations, through discussions with partners and looking at kind of trends and trajectories over time. Next slide, please. So we will want to talk with you about assessments and care planning and reviews, the care provision that's available for people, your involvement in safeguarding and risk management, mental capacity. We'll talk to you about direct payments and unpaid carers and things around transitions, particularly young people's transitions, but only where your role has got some involvement in those things. And again, we're not testing your knowledge. We're just wanting you to contribute to the picture that we're developing about these things in your local authority area. So to help you prepare for this, you might want to do some of these things with your teams. So think about the themes in the Care Act that you're particularly responsible for delivering, which duties are most pertinent to your team. Have a look at our assessment process on our website. It does set out clearly the evidence that we will be looking for and which quality statements we will be speaking with social work teams about. You know, talk about what's being done within your local authority, what's the DAS doing, and there might be opportunities for you to contribute to the self-assessment that your local authority will do as part of this work. To really help understand your current performance risks and challenges and the plans to address them. So there's a few things that you can be thinking about doing there in anticipation of our assessments. Yes, there's another slide. I wasn't sure actually, but yeah, another couple of things is about sharing, just thinking about what insights do you have about people's experiences, what local activities, organisations and projects exist that we can tap into to add to our insights. So, because you've got your ears to the ground, you're the eyes of the organisation, you're much closer to the community activities, and you're really well placed to be able to inform us of things that we might want to just explore a little bit further, and just really think about those things that are working really well for people. And we're really keen to hear about innovation and new ways of working. So please, if you've got any of those, then, you know, make sure you shout loud and proud about them when we come to talk with you. I think that's all I have to say now. I will hand over to I'll hand back to Iona, actually.
Yeah.
Thank you.
Jeanette, thank you. And thank you, Lella. We are now going to, Louise, if you can come in and talk from Social Work England point of view as the individual professional regulator for social workers. It was really helpful, Jeanette, to hear, and Lella, some of the ideas for social workers, particularly I'm clearly focusing on, around what CQC is looking for and why social workers and how they can get involved and what to expect. Thank you. Louise, please come in.
Hi, nice to meet you all. My name is Louise Broddle. I'm Head of Investigations here at Social Work England, and I'm also a registered social worker. So I'm going to talk to you about the role of Social Work England as a professional regulator, some thinking about how social workers may prepare for the local authority assurance work, and then considering the impact of CQC's work on Social Work England. So just firstly then thinking about setting the scene. So Social Work England is a specialist body with responsibility for regulating social workers in their vital role. And we were established by the Children and Social Work Act 2017, which requires us to regulate social workers in England to ensure public protection by promoting and maintaining professional standards, promoting and maintaining public health, safety and well-being, and ensuring public confidence in the profession. And our secondary legislation is the Social Workers Regulations as amended, which drew on evidence and recommendations for effective professional regulation from numerous places. And this includes reform proposals for healthcare regulation and the Law Commission's recommendations on health and social care regulation. And we at Social Work England have created standards. So we have our professional standards and education and training standards. And these standards set out the requirements that we expect social workers and social work courses to meet. These are specialist to the social work profession and reflect the values and diversity of social work practice and the positive impact it has on people's lives, families and communities. It's really important to note that we regulate all social workers in England, irrespective of the setting. So, for example, whether somebody works in children's services, adults, private sector or public sector, we regulate all social workers in England. Next slide, please. Oh, thank you. Okay, so just then moving on to some reflections. So social work is about people and relationships. This is the decisions social workers make, even if right and lawful, we know can be unwelcome at times, and their work is not always based on a model of consent. We often receive a high number of concerns. In fact, we receive a high number of concerns each month, ranging from a range of people, from members of the public, social workers, employers, employees, and other professionals, including other regulators. There are several routes into social work. There are apprenticeships, fast-track programmes, master's programmes, degree qualifications, and that changes over time in terms of the routes into social work. Also to note that we are unique in our setup, so we are an arm's length body, and the Department for Education, so the DFE, is our sponsorship department, while social work is led by both DFE and Department for Health and Social Care. So we are unique in how we are established. Okay, thank you. So just then moving on and thinking about when concerns are raised. So where there are concerns in relation to a social worker's practice, we at Social Work England consider whether there are reasonable grounds for investigating and whether the social worker's fitness to practice is impaired. So we have what we call a triage test, and in applying this test, we must determine both of the following: whether there are reasonable grounds to investigate the concerns and whether the concerns suggest current impairment. And more information in relation to the grounds of investigation and the triage test can be found on our website if you haven't already seen that. I wanted to add this point in because I think it's really important to emphasise really that we will not open investigations into social workers purely based on the CQC rating of the local authority. Our role at Social Work England is to consider social work practice, not the organisational practice and or system. I think it's also important to note that social work and social care are fundamentally different. Social work is a profession and social care is the workforce. Understanding this distinction is at the heart of properly evaluating how each is overseen. And as we've heard, CQC regulate the local authority system, how they deliver their Care Act duties, and we at Social Work England regulate the social work profession, individuals working within the system. Okay, thank you. So moving on then in terms of thinking about how social workers may prepare for the CQC assurance visits, and obviously CQC are more of an expert on this than I am, but I just wanted to draw your attention to some work that the local government association, so the LGA, commissioned from learning from the pilots through interviews with directors and looking at their experience and what advice they have for other councils. So that is within a document called The Return of the Regulator, What Adult Social Care Needs to Know, and that was published in December, and the document includes a top tips document. Okay. So this slide is just thinking a bit about the impact of social workers and workforce. And again, this is taken directly from the local government association document and some reflections that they've made. So thinking about frontline staff, they commented that sometimes people were anxious and apprehensive about being interviewed by CQC during the online on-site visits. And as CQC have said, they want to hear views and experiences and showcase good and innovative practice, which I think is really important to remember. And it's not about investigating individual practice, CQC looking at the system. We're keen here at Social Work England to hear about the good and innovative practice. And we've started to think about how we work closer with CQC to better understand the local picture and the outcomes of those assessments. Thank you. Next slide. Oh. Sorry, can you just go back a slide? Sorry, Fiona. And then just thinking about principal social workers, and I wanted to include this because through the pilots there was a collective expressed need for support in their roles in the assessment process, and the LGA are providing webinars, tools and workshops to support specifically for principal social workers going forward. So again, a useful tool there. And thinking about consulting with staff, again, it was noted you need to create the right environment for staff for constructive and positive engagement, which very much came through from Lella and Jeanette's presentation. And one of the top tips from the LGA is around encouraging organisational self-awareness. So thinking about critical awareness of your strengths within the local authority and areas for development, and demonstrating confidence in your strengths and progress with clear evidence, and acknowledging when things may need improvement. And again, that's all within the top tips document. Thank you. Okay, and this slide, again from LGA, is some feedback from the pilots. So you can see here it was seen as an opportunity, also recognising the work involved. And as I've said earlier, some top tips are available. And also thinking about it being a positive process which helps to drive improvements. Okay, thank you. So just then thinking about positive impact on Social Work England, this is my final slide. So one of the things that may happen, we may see an increased number of concerns raised to Social Work England about local authorities rated, for example, inadequate for members of the public and or employees or employers. If this happens, we'll need to think about our communication strategy and how we better explain our role and function. Also thinking about how we engage with stakeholders, including CQC, of course, to collectively help people to better understand our role and function where needed. So again, thinking about the differences between professional regulation and system regulation. And the findings from CQC's local authority assurance assessments will help Social Work England to better understand local pressures and challenges. And this links really nicely to our strategy for 2023 to 2026. And one of our objectives, which is in relation to further developing our data and insight we hold about social work profession, our regulation, and how we develop an insight approach to support improvements to the wider social work profession. And also we'll use data and insight from others, so from CQC and from other regulators and other stakeholders, to inform our own activities and how we regulate. So we are really keen to understand the outcomes from the local authority assurance work and hear about best practice and new and innovative ways local authorities are providing care and support to local people, and the social workers' role in this and how we can support as well. Thank you.
Thank you, Louise, and thank you, everyone. I think it's now time for question and answers. I'm going to remind people that you can use the Q&A section at the top of your screen. Feel free to add any questions you might have for Jeanette, Lella, or Louise. And I will start probably in a second, just checking that now, with one of the questions. And I'm going to ask Kate, my colleague, to have a look through the questions coming through as well and come in and ask everyone. Right. This is a question for CQC, I believe. as a social worker, should I be concerned about you completing case tracking? Do you share the outcome with Social Work England? I'm very much aware this is a question few social workers been asking for the last few months, last year, I must say, because I have come across in my role quite a bit around that. Thank you.
Okay. Shall I take that?
Yeah,
thank
yes,
you.
Jeanette, please.
So if I could ask Lella perhaps to comment on that question, thank you.
Yeah, so with case tracking, the main aim of case tracking is to talk to the people who are using services or their unpaid carers. And so the reason that we ask to look at their records is that sometimes when we talk to people, they'll tell us that, you know, I'm not really sure. They said they were going to get me an OT assessment. I'm not really sure if I've had that. And so if we need to, then we can look at the records and see. It gives us that rounded picture. We don't know what your care records policy is. We don't audit. It's not a records audit. So we are not feeding back to Social Work England about a local authority's state of their records. What we will do is if somebody tells us something in our discussions during case tracking and we can't find the answer within the records, we may request, and that's likely to go through the principal social worker, that we speak to the relevant social worker just to help clarify what that situation is. But I think that won't happen on a regular basis. So the only times that we are likely within our whole assessments to come to Social Work England is if we have, in the course of our conversations, we have a real concern about somebody, not expect a social worker, not expecting that to be something that happens routinely, but just to reassure people that we don't feed back to Social Work England our general feedback. As Louise said, she'll be Social Work England will be interested in the reports because it will help to give them a picture of the local authorities. I don't know, Jeanette, is there anything else you want to add?
No, I don't think so. Hopefully that answers the question.
I must say, I just quickly look at the Q&A as well. And the first question I could see was, are we going to share the slides? And I think the answer is yes. If you are interested, we can share the slides, absolutely. But also please remember this session is recorded and will be available on the YouTube Social Work England channel in a couple of weeks. Another question is, this is again for CQC, how do you plan your schedules? And I think you already covered a little bit, Lella and Jeanette, but if you want to add anything, and if you are going to share that, if you want the timetable with Social Work England, but I don't presume any answers to that.
I'm going to pass that over to Lella again, if that's okay, Lella.
So,
thank you.
Yeah, so we have some principles that we use when scheduling. So we would, some of that is about, are we making sure that we're covering the country fairly evenly? Are we making sure that in terms of the workload that we're taking on a mix of sizes of local authority? But also one of the biggest issues for us is about, in terms of reducing the burden on local authorities, is about being aware about what other workloads that local authorities have on, and that might be from other regulators. So we don't share our schedules with anybody until we have sent out the information return request so that the local authorities are aware that we have started their assessment. And Social Work England is not one of the organisations that we send that confirmation to. We don't put on our website where we were going either. So we notify the Department of Health and Social Care and the LGA, but that's it in terms of routinely notifying external bodies. Who the local authority shares that with is up to them.
Yeah, just to add it, I mean, it's absolutely, we respect that the local authority should be the first to know, and as Lella said, it's then if they want to share that's entirely their information to share. And one other factor that influences our scheduling is local authority elections, and the need for us to be mindful of that and not be on site during those, which essentially provides a big challenge for us because there's a lot of that activity, and we have a short window, in a sense, to deliver 153 assessments. So the further through the schedule we get, the less scope there is for flexibility, because there's fewer local authorities left to choose from. And we take account of ICS assessments that are being done as well. That's not to say we won't. We will always do a local authority assessment before the ICS, or vice versa. But it's just to recognise that you know, one can inform the other. So there's a number of factors that we're taking account of in our scheduling. I think the principles might be on the website, Lella, is that right? But not the actual schedule.
I can't remember. I'd have to check.
But
Sorry,
there's something. Yeah, there's something just to set out in one of our news updates about the type of things that we'll consider when we're scheduling. Just the things that we've said there.
Okay, I'll have another question, and I think I'll ask after that Kate to see if we have other questions coming through. This is for you, Louise. How we can, for Social Work England, I think will be just fair, because we have asked already 2 questions to our CQC. How we can make regulation and regulatory frameworks easier to understand to the public, how we can promote better understanding for all people around regulatory frameworks.
Yeah, no, thank you. So firstly, just thinking about feedback. So gathering feedback, thinking about, you know, for example, how our website is understood by members of the public, how we interact with members of the public and other stakeholders is also really important. And also, you know, thinking about how we, for example, continue to evaluate concerns that we receive and whether people have understood our role and function when sharing concerns with us. And this will help to inform changes needed as a result of that. We've worked really hard to make sure our website and public-facing information and engagement is accessible and understandable. However, we know that we need to do more. In last year, 2022, sorry, I'm losing my years there, Social Work England commissioned some research into public perceptions and experiences in raising fitness to practice concerns, and this research is now published and can be found on our website. It's really interesting, this public perceptions work, and from what we know from it, there's a high public awareness of social work as a profession and a good understanding of the types of support social workers provide. However, there's less of an understanding of the environment that regulates social work, so we know that we need to do more. So this year we will start to use the findings from this and our other research to design and deliver a campaign which will promote public confidence in social work. And Ioana, I know you mentioned that earlier on in terms of some of the kind of work that we're doing around that, in terms of the campaigns, you know, to think about how we inform and educate the public on what social work is and the important role that social workers play in society. I think just finally to say that, you know, there's a collective responsibility on people working within different sectors and systems, including regulators, employers, social work education settings, for us all to continue to raise awareness and understanding of the purpose of regulation and regulatory frameworks and how we can better work together. And fundamentally, it's about public protection, isn't it? And how we all kind of work together to achieve that, really.
Thank you, Louise, and a really good prompt, in fact, about Change the Script campaign, which started on Monday. If any of you colleagues in this meeting, you haven't had a chance to look at it on our website, Social Work England website, we also have a video and a little bit more information. I'm now looking at the Q&A, and it's a question which I must say I'm not particularly surprised. I'm not going to say the name of the person just because to protect confidentiality. With pressured budgets and increased demand, social workers are under pressure to manage waiting lists while delivering a person-centered service. How will CQC report reflect pressure on social care? Back to you, Jeanette and Lella. Thank you.
Yeah, thanks. It's a really important question. I'll answer that and ask Lella if she's anything she wants to add. But yeah, I mean, we are aware of the context in which social care is operating and the pressures on the sector and all of the factors that are increasing that are leading to increased demand for support from local authorities, increasing numbers of people wanting Care Act assessment, and workforce pressures that mean we can't always recruit and retain the right people to deliver the work. So there's a lot of factors at play here, and one of the outcomes of that, the consequences, is that sometimes there are significant waiting lists within local authorities. So we, in our assessments, we're not there to make excuses for a waiting list or anything like that. What we're there to do is to look at what is happening in that local authority. So to have a waiting list, there'll probably always be a waiting list. But what we're interested in is, how is the local authority managing that? How is the local authority enabling people to essentially wait well and wait safely? So, we wouldn't judge a local authority harshly if it has really good insight into demand for assessments, demand for care, really understands, the size of waiting lists, really understands how its social work teams are supported to do those assessments and to be able to do them well, despite the fact that people may be waiting. So, we're seeing that some areas are putting good triage systems in place, that they're looking at ways to assess risk at the point of initial contact. And so in order to be able to manage those risks that people might have whilst they're waiting, or to deal with more simple requests in a different way, and they might have started to develop different teams to support that. So it's very much, we provide the opportunity for the local authority to do its own self-assessment of what's happening in its area, how it understands risks and issues such as waiting times, and how is it working to support people to be safe and maintain the well-being of the workforce. Because we know that if you're a social worker and you've got a big waiting list over your shoulder, that can affect you, because you may go away be worrying about that, the impact on people. Does that reflect on you as a professional worker? And it kind of can feel like it's compromising your ability to work well. So we're interested in all of those things, but we need to report what we see. We need to be able to be saying, across the country, this is what we're finding about demand for care. This is how local authorities are managing or not to respond to that. This is how local authorities are supporting its workforce. So yeah, it's about taking it in the round.
Thank you so much.
Did you want to add anything to that?
I was just going to say that, as well as what you've said, Jeanette, is that our chief inspector meets with the minister on a regular basis, and part of our independent voice responsibility is to feedback themes and trends. So the more local authority assessments we're doing, we can build up a bigger picture of some of those issues and feed them back separately to what we're reporting on.
Yeah.
Really helpful to hear that. I'm sure that many colleagues in this meeting will probably welcome that message. Now we have another few questions going on. I'll try as many questions to squeeze in. And I must say, I don't know what's the acronym standing for. A question for CQC, what's the IR? Is that interim report or scheduling? And initially I was thinking, is that my surname and my name and so on, has been sent. Is there a 6 months plus wait for the on-site visit? Will CQC request an IR update respective data? To me, clearly someone who knows your process very well and the assessment framework, which clearly, yes. Can we clarify what's the acronym for everybody's benefit? And I must say, we have ICSs earlier, integrated care systems. I was kind of wanted to use to support it. What is IR?
Oh, well, Lella, would you like to take that one?
The IR is the information return. So it's when we notify a local authority that we've started their assessment, we ask for them to return the information return, which is a detailed request of information and evidence that we ask for that is clearly linked to each of the quality statements. And it also includes requesting a copy of their self-assessment if they have one. And so in terms of, because we are batching activity, it may be several months before the site visit. Now, if that happens and we need, then we would clearly ask when we're at the site visit for updated evidence for something that may have changed. So, for example, we've just done some site visits and we have asked for different updates at each one because it's different relevant data that we needed updating. So yes, we won't ask somebody to completely send us another information return, and we don't want people to suddenly send us a whole load of updated data when we notify you of the site visit. We will ask if we need some additional updated data, and we'll either get that through conversations with senior leaders on the site visit, or we'll request it more formally whilst we're there or just after we leave.
Thank you. Can I just say the last question probably we might take is something which might be on everyone's minds at the moment, and probably no surprise to any of us. Will a general election impact on the scheduling? Therefore, I'm going to go back to CQC because I'm very much aware of Social Work England does not have a schedule around that.
I mean, in terms of there's the period during which we aren't able to engage directly in certain activities during the PERDA period. So there are some restrictions around activities for local authorities and for CQC during elections, whether they be local or general elections. So I'm sure there will be some impact, but exactly what that impact will be is difficult to say, because some of our activity, well, only a small part of our activity during the assessment is on site. Lella's explained that we gather a lot of information and evidence before and after, well, mainly before that on-site period. So we are likely to be able to continue doing that activity, and we might not be able to do the on-site bit on the week that we plan to do it. But it doesn't mean to say that we won't be able to do any assessment activity during a month, for example. So there will be some impact probably, but I can't say that it's going to delay assessments or have a massive impact on the schedule. Lella, did you want to add anything to that?
No, absolutely agree. And currently we won't publish reports if there are even for local elections going on for that week. So it doesn't matter even if there's no local election at the local authority where we have just done the site visit. If we were due to publish, we will hold that off for a further week. So yeah, there will be some impact, but it will be minimal.
Great, thank you. I think we do have, I must say, Helen, I think, posted that question. I think is a really relevant question. Thank you, Helen. I guess this is more or less everything. We do have another question. I'm not sure if we are running out of time, which clearly we can share with CQC. You might want to maybe respond to the following questions. We're happy to share that with clearly anonymizing the names of the people asking those questions. Right, can I just say a big thank you to all of you. We hope you have found this session helpful. From my point of view, from our point of view, it's really insightful, and we hope that if you're a social worker, you might also consider utilizing this for continuing professional development. CPD, a little plug there, because it's one of our professional standards, Louise, isn't it? Yeah. And definitely I would encourage you to have maybe a reflective discussion with some peers or some colleagues, and that might complete some of the requirements we have for this year. But thank you very much. And I can see that Kate already has shared in the chat a clear feedback and survey. Do contribute to that, and really big thank you once again for participating in this session, and we are looking forward to see you in the following session across the week. Thank you, everyone. Thank you.
Thanks,
Bye.
everyone.
Thanks.
Thank you.
Bye.
Bye. Thank you.